touching on the last point of vaccine, when do you, sir, expect a vaccine to be available, and how successful? I know it's a very far-fetched question to ask, but how successful do you think implementing a vaccine coverage in India is going to be to prevent further corona?
So the kind of candidate vaccines that have been finalized, and even the solidarity trial by WHO, which is happening, India is a party to it. I think the efforts are definitely underway in mostly unprecedented manner compared to any other vaccine itself. So we will get there faster if there is an answer. And the hopes are also high because it's a relatively stable genetic sequence. Therefore, can you then remodel the existing platforms and try, or can you try another kind of tools that we have in terms of targeting RNA virus? So those are the things which the virologists and people who are in the vaccine field should be able to say. But I am hopeful that 18 months is the optimistic time frame. And again, I'm optimistic that one of the Indian companies which are involved in several of the trials might be the ones which will get license also to manufacture once it is licensed or once it is approved for human use. Because no other country except for India and few other, maybe even China, has the capacity to manufacture for the entire world. So from that point, we have slightly a better advantage. And in terms of rolling out in a program when vaccine is ready, I think now we have established a completely wonderful infrastructure in delivering vaccine programs in this country. So I have no doubts about it.
So on that optimistic note, I would like to end by asking you your final opinion. Can the Indian healthcare system use this as a wonderful opportunity to reform the public health measures? So from your view, as one of the foremost epidemiologists and public health specialists in this country, what would be the 3 recommendations or suggestions you would like to see in terms of healthcare reforms in this country going forward?
Again, an excellent question. Within many pandemics come and go. We have seen every time a situation like this comes, this has been very difficult to handle, but whenever such things come, we are very reactive, very responsible, and then soon after that, we tend to forget as a system. I think that should not happen now. This has exposed, although it is successful for India in terms of how we contain, and I'm very optimistic about the COVID-19 situation itself. It's a wake-up call for us to make sure that public health system gets strengthened. First and foremost is have a public health workforce in this country. We do not have a workforce which will detect and control outbreaks. Kerala did it so well because they used community for ensuring that quarantine is done well and social support is done well. We can't be expecting that everywhere. Whereas if you have a public health workforce, starting from the village level till the state level, we should be able to contain any pandemic like situation and also to improve lifestyle. Number 2, we should be increasingly looking at data and not on opinions of a few people to make policy. So evidence-based policy implementation is what we should, at least to a reasonable extent, we should be following. Looking at the kind of burden that India has, what are the things that we should be prioritizing and implementing? Number 3, what doesn't get reviewed doesn't get implemented. So therefore, we need to have stronger review mechanisms from the village level till the national level in terms of what our health goals are. When I say health, it's beyond you and me and everybody in medicine. So the determinants of health are mostly not medical. They are our lifestyle, the nutrition, the kind of exercises that we do, whether our ecosystem permits for a healthy life or not. These should be part of preventing diseases. And even as a treating doctor, for you and for the rest of all my colleagues, the outcomes will be better if the determinants of health are taken care. How long do we continue to say that India is, not in a position to cater to this or that illness? I think that should go. That will happen only when you prioritize public health which is most important need of the hour.
And do you think that at the central level or sort of overseeing, India needs a board of doctors, public health specialists to be at the forefront, to address the queries of the media, to be dictating the national policies on health and be pure scientific or from the medical fraternity rather than from the bureaucratic or the political field?
I get what you're saying. This is a very important thing that as a country we should look into. If I'll just give an example. We have set a record. The Secretary of Department of Health and Research is a medical person. So if that's possible, can we have for public health or for anything health related things, people who are from the same fraternity delivering things? So for that, we need to do several things. One, doctors will have to then understand how administration is. That has to be focused. Two, not just doctors. In public health, you need people who are in public health engineering, social sciences, those who are in biostatistics. Because without all of this, COVID-19 situation has shown us how increasingly we are dependent on teams of public health professionals than just the doctor alone. So just doctor-centric model is also not going to work. We should learn how to work in teams. If Kerala is successful because of the society and the kind of response that they took, which had the medical response as the central focus. Doctors can't do well if the society doesn't support. So therefore, public health response has to be a social response with doctors playing the central role in terms of decision making and also policy and advocacy and communication.
So on that note, thank you so much, Dr. Giridhar, for joining us on this wonderful discussion. We did a lot of number crunching. We talked about antibodies and finally your recommendations for the public health measures. Thank you so much for joining us.
Thank you, Nitin. Bye-bye.
With that, we come to an end of interesting series of episodes on the coronavirus and the epidemiological perspectives associated with it. We thank Dr. Giridhar Babu for this fascinating discussion. If you have any feedback, please do write it in comments. You can follow us at Facebook at facebook.com/treat4doctors. You can also visit our website www.alterdoctor.in. And if you want more such interesting videos, please don't forget to subscribe to our YouTube channel, Treat for Doctors. Until next episode, this is your host, Dr. Nitin Yashas, saying goodbye.